Root canal is one of the most feared dental procedures. Years ago, people would have to have multiple visits to get root canals done, and those visits could be an hour each time. It could be 3 hours to get a root canal treated. With new techniques that we have today, most root canals can be completed in less than 40 minutes. The treatment is virtually painless because we have better techniques. We use stronger anesthesia, articaine, which numbs the tooth much more than we used to be able to do in the past.
I had 2 root canals, 2 the same day. I actually went back to work. I talk on the phone for business, work the straight through, no problems, no pain, nothing. 2 root canals.
We can give the patient ibuprofen, which is like Advil or Motrin, prior to their treatment. We're able to treat the tooth quicker because we have better instruments. We can use rotary files to clean and shape the tooth better to complete the root canal. If a patient is having discomfort during the procedure, we're able to put topical anesthetic on the files used to shape the tooth to make sure that they don't feel anything during the procedure. After the root canal is done, we are able to manage the discomfort that most people experience for a few days with pain medication. You've just had root canal. What I recommend is to avoid the tooth for several days. Typically, a tooth that's had root canal will be sore for 3 to 5 days. Eat on the other side of your mouth and try to eat soft foods. If you have increasing pain after 3 to 5 days or any swelling, I recommend you see your dentist as soon as possible.
I was petrified when I first came in. I was in need of a root canal. And one of the girls I worked with said, "Hey, I go to this dentist. Why don't you give him a try?" I did, and I've been here ever since.
I was a policeman for 30 years. I'd rather face an armed felon than go to the dentist. I would highly recommend Dr. Jerry Gordon. He's the best dentist I've ever been to. If they have any type of fear, he's the guy to see.
What happens when people are afraid of the dentist is that they often will avoid dental care. They'll be taking over-the-counter pain medications to manage the pain. They'll schedule appointments at the dentist and then not show up for those appointments. They'll avoid areas of their mouth where they have broken teeth. And the problem with that is by avoiding dental care, they are actually risking getting dangerous dental infections. One of the things that you need to do is find a dentist that won't scold you and also lets you have some control over the treatment that you need to have done. Some patients can benefit from a mild sedative like Valium and nitrous oxide gas as well. But I found that the most important way to help a patient overcome their fear of the dentist is when you have an open line of communication from the dentist to the patient. And I found that way the patients are able to get their treatment done in a very comfortable and ordinary way over time.
I would like to let you know my first visit here, I was so scared and so nervous, and Dr. Gordon answered all of my questions, and eventually I opened my mouth.